Did you know that women are 30% more likely to visit a doctor than men? Women are also much better at keeping up with health checkups, often skip checkup help and ignore symptoms. When symptoms last a long time or certain patterns show up, it can mean something serious is going on. Today's video is about symptoms like dizziness, extreme thirst, and constant tiredness that you should not ignore. Let's get started. Number 14, dizziness. Dizziness is when you feel lightheaded, unsteady, or like the room is spinning. It happens when there's not enough blood flow to the brain, which can be due to a sudden drop in blood pressure or dehydration. While dizziness can be related to common issues like the flu or allergies, it might also mean something serious like heart disease, stroke, or shock. Number 13, shortness of breath. Shortness of breath during daily activities should never be ignored. If you have trouble breathing even after light exercise, it could be a sign of coronary artery disease caused by blockages in the arteries that carry blood to the heart. Number 12, excessive thirst. Being thirsty all the time could mean there's a health problem. One common cause is diabetes, where high blood sugar levels make you drink more water to flush out the extra glucose. Regular blood tests can help check your glucose levels and catch diabetes early, especially if it runs in your family. Excessive thirst can also be a sign of internal bleeding, infection, or organ failure. Number 11, bloody or black stool. While bowel movements can change color due to diet or medication, it's important to notice if your stool becomes pale, black, or bloody. These changes can signal serious problems like bleeding in the digestive tract. Bloody or maroon stools might mean bleeding in the lower digestive tract, and frequent occurrences should be taken seriously. This could be a sign of hemorrhoids, bleeding, or ulcers. If you notice unusual stool color changes, contact your doctor right away. Number 10, frequent fatigue. Feeling tired after a bad night's sleep or physical activity is normal, but being very tired for a long time is a sign to see a doctor. Long-lasting fatigue can mean serious issues like certain cancers, infections, kidney or liver disease, diabetes, and heart failure. It can also be due to sleep disorders, thyroid problems, anemia, or mental health issues like depression. Number 9, excessive snoring. If you or your partner wakes up because of loud snoring, it could mean obstructive sleep apnea. This condition interrupts breathing during sleep, causing daytime tiredness and higher risks of high blood pressure, irregular heartbeat, heart attack, and stroke. Number 8, persistent cough. Most coughs go away within a week, but if a cough lasts longer, it might be serious. Chronic infections like bronchitis, asthma, acid reflux, and sinusitis can cause ongoing coughing. Some medicines for high blood pressure, like ACE inhibitors, can also cause coughing. If your cough lasts more than 3 to 4 weeks, see a doctor. Smokers should seek help too, as a long-lasting cough can signal serious lung issues like COPD or lung cancer. Number 7, frequent heartburn. Occasional heartburn is usually not a problem, but having it at least twice a week might mean you have gastroesophageal reflux disease. Gastroesophageal reflux disease can cause inflammation, bleeding, and ulcers in the esophagus and increase the risk of cancer or precancerous conditions. Number 6, trouble with vision. As people get older, their eyesight often gets worse. Regular eye exams are important to catch problems early. Symptoms like blind spots, blurry vision, tunnel vision, or seeing halos around lights can signal serious eye conditions. An eye pressure test can detect glaucoma and other issues like cataracts, diabetic retinopathy, and macular degeneration. Vision problems can also be linked to strokes or brain tumors. Number 5, swollen or stiff joints. If you have stiff or swollen joints, it could mean there are underlying health issues. This can affect parts of the body like hands, feet, or knees. It might be early signs of arthritis or osteoarthritis, but it could also indicate more serious conditions like autoimmune arthritis, hormonal imbalances, immune system issues, poor nutrition, or lack of physical activity. Number 4, Skin changes. You should see a doctor if you notice a new freckle or mole that has an unusual shape, or if an existing mole changes in size, color, or starts bleeding. These changes can be signs of skin cancer. Men who spend a lot of time outside without sunscreen are particularly at risk. Some forms of skin cancer can be deadly, but if caught early, it is often curable. Number 3, frequent urination. Frequent urination can signal underlying health issues. Diabetes can cause this as the kidneys work harder to remove excess sugar from the blood. Prostate problems can also lead to frequent urination, along with symptoms like reduced urine flow, pelvic discomfort, and blood in the urine or semen. Prostate enlargement is common in older men but should not be ignored as it can mimic more serious conditions. Number 2, constipation. Occasional constipation is common, especially in older adults. It usually happens when you don't have enough fiber in your diet, don't drink enough water, or don't get enough exercise. However, chronic constipation is different. If you are constipated for a long time, it can cause discomfort and lead to other health problems like hemorrhoids, which are painful swollen veins in your rectum. Chronic constipation might also indicate more serious health issues. It can signal conditions that interfere with normal bowel movements, like physical blockages, tumors or twists in the intestines, or problems with how the muscles in your colon move. If you suffer from chronic constipation, it's important to see a doctor. Early diagnosis can help identify the cause and lead to effective treatment. Your doctor might suggest dietary changes, like eating more fiber and drinking more water, or recommend medications to help regulate your bowel movements. Further tests might be needed to rule out serious conditions. Getting proper treatment can improve your quality of life and prevent more health problems. Number 1, erectile dysfunction. Erectile dysfunction can be a sensitive topic but may indicate underlying health issues. Erectile dysfunction can signal poor blood flow, which might mean trouble in other areas like the heart and brain. Developing erectile dysfunction can predict a heart attack or stroke within the next 10 years, similar to risk factors like smoking or a family history of heart disease. If you experience erectile dysfunction, it's important to talk to your doctor. They can help determine the cause and suggest treatments. Sometimes erectile dysfunction is related to diabetes, high blood pressure, or high cholesterol. Lifestyle changes like exercising, eating a healthy diet, and quitting smoking can improve erectile dysfunction and overall health. In some cases, medications can help. However, addressing the underlying health issues causing erectile dysfunction is crucial. Regular checkups can monitor your heart health and catch problems early. Don't ignore erectile dysfunction, as it can be a sign that your body needs attention. Taking action can improve your quality of life and help prevent serious health problems. Do you ignore simple health symptoms? Let us know in the comments below.